Hello, good afternoon. My name is Jonathan Burks, and I am BPC's Executive Vice President for Economic and Health Policy. Thank you for joining today's conversation, the 2025 Healthcare Policy Wrap-Up. As we all know, Congress has considerable work ahead of it, negotiating government funding, considering the extension of critical healthcare provisions, and balancing all of this amid maintaining stability for patients and providers. But within debates over issues like the enhanced premium tax credits, Medicare telehealth flexibilities, the acute hospital care at home program, and others, there remains a real opportunity to move beyond short-term fixes and toward long-term bipartisan solutions. And that is exactly what today's discussion is about, identifying where common ground exists, where we can build on it, and how we can move forward together. We are joined by a really fantastic panel today that brings together decades of Capitol Hill and White House experience. I will let our moderator, Michael McAuliffe, introduce them in just a moment. Thank you again for joining us. I also want to thank the Commonwealth Fund for their support of and partnership in this event. I will now hand it over to Rachel Newsom with the Commonwealth Fund.
Thanks so much, Jonathan, and thanks so much to all of you for joining us today. I'm Rachel Newsom, Senior Vice President for Policy at the Commonwealth Fund. Our goal at the Commonwealth Fund is to make sure that we can help to educate and inform policymakers and stakeholders such as yourselves. And we're thankful to look to BPC and to our other partners as we take on this challenge. With that, I'd like to turn to Michael McAuliffe from Modern Healthcare, our moderator for today's event.
Yeah, hi, folks. Thanks for taking some time out of your day 22 of the shutdown. We have a great panel for you. We've got Yvette Fontenot. She is the CEO of Impact Health Policy Partners, and she brings a ton of federal healthcare policy expertise to us with nearly 25 years in senior staff roles in Congress, the White House, and at HHS. And she still advises policymakers on healthcare coverage, affordability, and quality today. Chris Jennings is the founder and president of Jennings Policy Strategies. He brings over 3 decades of federal health policy experience. He advised Presidents Clinton and Obama and has led some really large bipartisan reforms to sort of improve healthcare access, quality, and affordability. Amy Jensen joins us from Split Oak Strategies, where she is a founding partner and principal. She's a seasoned Washington, D.C. healthcare leader with lots of experience in the White House, Congress, and leading healthcare organizations. She's played a key role in some really big healthcare reform efforts. And then we have Dr. Rodney Whitlock, who is a principal with McDermott Plus. He joins us today with more than 2 decades of experience up on the Hill, including staff on the Senate Finance Committee, where he specialized in rural health, healthcare safety net programs, and disability policy. I guess where we want to start with this is with Rodney and Yvette before we get to the broader panel. And I want to start with a couple of questions for the two of you guys to sort of set the stage for the discussion. And I guess the sort of really gnarly place we're at right now is with the shutdown. And Yvette, how have health policy priorities, like the impasses over the enhanced advanced premium tax credit extension, which is a real mouthful, become intertwined with negotiations over government funding?
Yeah, thanks, Michael. It's such a great question. Thanks for asking it, and thanks for having me. It's great to be on this panel and see so many friendly faces. I'm going to start at a very high level here to try and answer your question, which is to say maybe the obvious, which is that healthcare is a kitchen table issue. It's an economic driver for families. It's a major cause of concern for families. It's been in the past a cause of job loss and medical debt for families. And as luck would have it, we have 2 new polls released just today that make that exact case. A poll from the AP NORC Center for Public Affairs, which shows that 6 in 10 of those surveyed are extremely or very concerned about their healthcare costs growing over the next year. Most participants rank their healthcare as extremely or very important to them. And 60% of survey respondents say that it's the responsibility of the federal government to make sure that all Americans have healthcare coverage. 60% of people don't agree that the sky is blue right now. So that, I think, is astounding. And at the same time, we've got a poll from Families USA with Heart Research showing that lowering healthcare costs is the top priority for American voters across party lines. and that 91% of voters say it's important for Congress and the president to act to lower healthcare costs. So setting that as a broad setting of the conversation that we're having right now around the shutdown, just to drill down a little bit, this is mostly related to the Affordable Care Act, which we passed in 2010. I was professional staff with the Senate Finance Committee at the time that we passed it. There were 50 million uninsured people in this country at that point. We had cost and quality problems. We were spending more than any other nation and getting less for our money. And with the passage of the ACA, we started to address those problems. Job lock disappeared, kids could stay on their parents' coverage, uninsured levels were at a historic low. And the interest in the Affordable Care Act just began to grow and continues to grow today, so that we were at a point in 2025 where enrollment had more than doubled from 2021 to 2025 to 24 million people. We had the greatest gains we saw amongst Black and Latino people. Small business owners, self-employed workers accounted for a large growth in the proportion of the marketplaces. And I'm getting to your question here. If you look back then to COVID in 2020, families were struggling and Democrats were intent on delivering relief, a part of which they did through delivering some assistance on healthcare through the American Rescue Plan of 2021. They passed these enhanced premium tax credits, which you just referred to, available to those purchasing on their own in the marketplaces. And they worked by increasing the amount of the subsidy for those already eligible and capping the premium contribution as a percent of income for people at all income levels. So those enhanced premium tax credits have mostly benefited people living in states that haven't expanded Medicaid. In fact, states like Texas, Florida, Georgia, North Carolina have seen the most growth in ACA enrollment since the subsidies were expanded. And other states that have had significant benefits include Mississippi, Louisiana, South Carolina, and Tennessee. If those enhanced premium tax credits are not extended when they expire at the end of this year, marketplace enrollees will see premium spikes by an average of 114%. That's according to KFF. And nearly 5 million people will lose their coverage entirely, according to the Congressional Budget Office. That's on top of a $1 trillion cut to Medicaid, the largest cut to healthcare in history that was part of HR 1. And what we're seeing out in amongst the stakeholders related to hospital closures, nursing home closures, the effect on community health centers, state budgets, consumers. So given the importance of healthcare, given the level of potential increases in healthcare costs to people, the possibility of coverage losses, you combine all those considerations with the fact that the Republican budget proposal that they've now voted on, I think 11 times, doesn't address those healthcare concerns in any way, doesn't include language to address any healthcare concerns. That fact sort of begins, I think, to explain the situation that we're in here with the shutdown being tied to healthcare concerns that members are hearing about from the constituents outside the Beltway.
So, you mentioned a whole bunch of sort of negative impacts and positive effects from the law. So, and also, I think there was some polling from the conservative firms that came out yesterday that find Republicans do better if they support these things. So, Rodney, from a Republican perspective, what do you see as the sort of key sticking points here for like each of the issues that Yvette was talking about, all the good things, the bad things, and what do they signal to you about Congress and the administration's sort of broader fiscal and policy priorities heading into next year, which of course is an election year?
Well, you've captured a good bit of it there, which is we're going into an election year. And both sides are, this is a shocker, rabidly partisan in believing their own perspective. Democrats, as Yvette very clearly stated out, very strongly believe that the things they're doing are good policy and electorally beneficial for them. Republicans just see it differently. Republicans have managed to go the last 15 years without ever truly, accepting the Affordable Care Act. They stopped, trying to get rid of it sometime around 2017. Thumbs down for those of you who are watching. But since then, they've been at a bit of a grudging peace with it. But now, where we are is that Republicans are faced with the issue of extending the tax credits, the temporary enhanced APTCs, and this is not a place they've ever been. And so a lot of effort has gone in this year to trying to bring them to the table, to try to get them to think about it. And I think that you've seen, particularly since Labor Day, more and more Republicans willing to consider it. The question is, are we anywhere close to a compromise necessary to get to something that would extend them in some way? And that's a lot more complicated when it's not even clear that the political considerations align on both sides to want to do a policy deal.
Well, you do mention some pertinent facts, and it sort of brings me along to the next question. It says there have been a handful of Republicans sort of looking at these things. There have been people talking about them, as you mentioned. But given this deadlock we're in right now, where do you see the sort of best opportunities for any kind of cross-party consensus that could perhaps unlock progress on these tax credits?
It's uphill to be sure. It's uphill that to sketch it out a little bit. The cost of 2 years, and anybody realistically having a conversation is having a 2-year conversation, because the next time you're doing an open season, you're doing it just a few days before the election. So 2 years at current temporary enhanced APTC rates is about $54 billion. Okay? So for Republicans, you've got to move them off of zero towards $54 billion, towards spending over a number of years. Republicans are probably going to ask for that to be paid for. They may want a policy change or two if they're going to play ball on the Affordable Care Act for the first time in 15 years. And there's this nattering little problem that Republicans actually did not have a role in how the Hyde Amendment related to abortion services plays in the Affordable Care Act. On the other side, and certainly I'd let my friend Yvette speak to this, which is, as Republicans move that way, can Democrats move off of $54 billion unpaid for, no policy changes and no changes to Hyde? Long way
How
to
about
go
that?
between A and B.
Well, how about that, Yvette? Is there something on the Democratic side where you see some sort of cross-party consensus?
Yeah, I mean, I think Rodney correctly points out that there's a big gap right now in order to just break the initial logjam here, which is that Democrats' position is they want a permanent extension of these enhanced premium tax credits, and that's what's been included in the Democratic budget proposal. So we need to get past this initial logjam of, cut the deal to end the shutdown versus end the shutdown to cut the deal. And if we can get to that point where we're actually negotiating on the substance of the matter, there's been a few proposals that have floated out there just in the press that we've seen. There is, the idea of putting some kind of income cap on the enhanced premium tax credits. There's the idea that people shouldn't be getting $0 premium plans. They should pay something for their premium. There are the abortion restrictions that Rodney mentioned. There's been this idea of grandfathering people who currently have the enhanced premium tax credits, but not allowing any additional people to receive those tax credits. I think those ideas, at least around the income caps and the $0 premiums, are, those might be open for negotiation if we get past this initial point of agreeing to extend the enhanced premium tax credits. I do think the abortion restrictions and the idea of grandfathering, certainly given the way the job market is going right now, are not necessarily things that Democrats would be able to agree to. But the main point is that we have to get to a place where we know that come December 31st, people aren't going to be facing 114% increase in their healthcare premiums and 5 million people losing coverage. And then we can have a real conversation about where we can have a meeting of the minds.
So before we get to the rest of the panel, there is one other sort of quick thing I would like to ask you guys about, because Congress has done bipartisan things on health issues before. Rural health, telehealth, things like that are pretty bipartisan. So where else might we see that kind of thing, and what is it that drives sort of true bipartisan collaboration and cooperation these days? And try to be pretty quick, because we gotta get to the other guys.
Sure.
Yeah.
I'll jump in real quick. Just a point. Telehealth is driving them. Everybody wants to talk about AI. I mean, right now AI is speaking for me. I'm, having lunch somewhere else. So, I mean, that's something that you can see them talking about, but the bar is high because they're not really in a great mood with each other right now.
I think that's well said. There's never really been a common place of agreement on the coverage issues. The cost and quality issues are I think are in a different bucket, and they have managed to find some areas of agreement around at least some major principles, if not specific policies in those areas. And I think that could continue.
Hmm. Okay, great. Well, that's all food for thought. So, um, whatever's going on with this shutdown, we're probably looking at more short-term extensions for, telehealth flexibilities, we're hospital at home, community health centers. I mean, I think we've had 6 stopgaps for community health centers in the last couple of years. Chris, can you talk about some of the potential risks that come with these sort of continued stopgap funding patches, excuse me, including for like the healthcare providers, for payers, and for beneficiaries and patients?
Sure. And I think even if we're talking about the marketplace policies, if it's only for 1 or 2 years, that's going to create challenges as well. And it really comes down to if you're a plan, if you're a provider, how do you predict? If you're a community health centers, how do you budget? Do you keep all your staff? Do you do part-time staff? Do you do contractual staff? Things that are making decisions that are counterproductive to, sorry guys, that are counterproductive to a thoughtful strategy and implementation of policy, and more importantly, how you serve your patients. So it's very, very frustrating. I will say many of these entities are used to it. And so they plan on it, but it absolutely is inconsistent with good, thoughtful policy and downstream impact on beneficiaries. And in fact, in the private sector, the Republicans in the tax policy, they really wanted to have permanent R&D tax credits. That was a very high priority items because people thought you can't really do 1 year extensions of tax policies. And similarly, I was listening to Rodney talk about pay-fors. They didn't really pay for their permanent extension of the tax policy that they just did. And so, there are going to be ways that I think Democrats and Republicans can work thoughtfully, both on these smaller policies and then maybe even on a compromise on the Affordable Care Act.
Hmm. Well, so Amy, there's it's not just the sort of outside folks who deal with this. How does this cycle of short-term fixes sort of impact the ability of the federal government to make long-term investments in healthcare? And do you see sort of any appetite on Capitol Hill to sort of build in more permanency into these policy reforms?
It's a great question. We do see a lot of interest on the Hill in trying to get to a more permanent place on these policies. They hear every day, from key stakeholders that they have a difficult time retaining staff, for example. How can you be hired to work at a community health center, and how can a community health center in good faith hire new staff if they're not clear that the funding will be there for them? There are real world implications for hospital at home. Patients had to be discharged from the program. This is a very bipartisan issue. It passed out of the Ways and Means Committee with unanimous support. And these beneficiaries in Medicare are not able to access this program right now, full stop. So there is a very significant desire to get to a more permanent place. The hard part, of course, is at a time of thin margins in both the House and the Senate, a time of lots of disparity between even factions within the Republican Party and, frankly, the Democratic Party. Finding a way for leaders to get to yes, and then find the requisite pay-fors to pay for it, that will pass in a bipartisan way, because most health policy, as we know, has to be done with 60 votes in the Senate, other than, through this reconciliation tool. As a result of that, it becomes very easy for these longer term solutions to be disrupted. And much to the chagrin of the folks who spent hours and weeks and months negotiating on them. So I know there's a very keen desire to get to a robust package this year that could address some of the longer term issues that need to be addressed because either the funding has already expired or the shutdown has, had some significant impacts on the ability for providers to operate and frankly to resist the temptation to consolidate into larger systems, which I know we all want to avoid.
Mhm. Yeah, no, I do hear that desire for a sort of broader long-term thinking up on the Hill, but it gets really gnarly pretty quickly. And let me just go back for a second to the current sticking point with this impasse on the advanced premium tax credits. For both of you, what do you see as the key sticking points, and where do you guys also see areas for that sort of cross-party consensus to try and get out of this, move forward?
Sure. Well, first you have to agree on the vehicle, you know, and I think Republicans now feel quite strongly it cannot be on the continuing resolution, and Democrats do. The question would be, if it's not, what would be the vehicle, and how would you ensure that the policy, that whatever policy is agreed upon in bipartisan negotiations is actually enacted into law? And one problem there is, of course, kind of a building up of trust that doesn't really exist that much in Washington. It's very, very, very challenging. And then there's dynamics between House and Senate that I think a lot of people don't really think through thoughtfully. You could see a bipartisan agreement potentially in the Senate that you may or may not see in the House, and that is another challenge. But why do I believe it's possible still? I still give it a better than 50-50 odds, but not much better, is from the outside looking in, the public is saying to both of these seats, a pox on both of your houses, don't let these premiums go up so much. Find a way to get to a compromise. And I don't think anyone will be well served by watching their constituents see a doubling of their premiums and also the downstream effects on everyone else in the marketplace. So I'm still holding out hope. I think we have to get to the vehicle conversation before we get to the policy conversation, before we get to the outcome, but I think it's still possible.
And Yvette did a great job, Chris, you too, on outlining some of the key sticking points that are currently being debated. But the issue that I want to raise is a more challenging issue, and I frankly think it's the key underlying issue for many Republicans, and that is, even though we've kind of moved on from the pre-existing condition debate around the ACA or Obamacare, or whatever you want to call it, there is fundamental disagreement about the structure of the program, and you've seen significant numbers of Republicans beginning to talk about how can we address the core underlying issues that they're worried about in terms of the growing aspect of the premiums that the government is now funding every year. There actually is a very small part, according to many analyses that I've seen and Republicans are talking about on the Hill, that is actually attached to the enhanced premium tax credits expiring. And instead, there are fundamental issues about just growth and cost in the program and what can be done, what should be done to address some of those changes. Those are much harder to resolve, much more difficult. There are ways that it can be done, I believe, in a bipartisan way, and build that kind of consensus across the aisle.
Well, just very quickly, I've heard some Democrats talk about going after fraud, and I've heard some cross-party talk about sort of costs escalating in healthcare and consolidation. Are any of those sort of areas where there could be cross-party consensus?
Yes, I think that there is real interest in doing something. Of course, when we're talking about cost, it isn't just unique to the Affordable Care Act, it's system-wide. And we need to look at consolidation, competition, pricing practices, et cetera, and prescription drug trend lines, et cetera. There is interest. I think when we move from the issue of access to the issue of cost, sometimes costs can be a bipartisan, bicameral discussion. Whether or not it can be a majority discussion is always the challenge, but whether it's part of the ACA discussions or whether it's part of healthcare system delivery reforms, system-wide, we absolutely have to do it. In fact, if we don't do better on cost containment, the cost of the product being delivered, then we won't be able to afford healthcare for anyone.
Mm-hmm. Well, the Congress is only part of the picture up there. We also have a White House and an administration. In terms of both tax credits and other extenders that have to, that are just hanging out there, um, if you want to reduce long-term sort of uncertainty so that states can plan better for more than one fiscal year at a time, is there anything that the sort of administration and White House can do to help that along, or is that all in Congress?
They certainly can, and this we will see their forthcoming budget resolution, which will be their first kind of more fulsome budget resolution, which will lay out some of their key priorities in the healthcare space. We've heard and talked a lot with the administration about the Make America Healthy Again agenda, which does overlap with a lot of this policy addressing chronic disease, making sure people are taking care of themselves and have good information on which to base their healthcare choices. So that will be a good opportunity to really look at some of those issues in a more comprehensive way. Heretofore, the Hill has really been driving and focused on these issues. I know there are lots of conversations happening behind the scenes about longer term solutions that could be moved forward. Certainly, we know how challenging some of the solutions are to find. I think the Hyde Amendment issue is a very significant one. I can't imagine not finding a resolution on that issue and seeing a bill move forward. The other challenge is, of course, the further we get past November 1st, the date when the exchanges open in many states, the harder it becomes to really address the issue in the near term. And that's something that we really can't understate, the importance of that aspect of any negotiation, and why doing this in the context of a negotiation during a shutdown is especially challenging to overcome.
Mm-hmm. Well, I mean, we're really focused on these sort of extenders and on the expiration of the tax credits because that's what the focus of the shutdown is. But there's a lot of other stuff going on up on the Hill in terms of sort of broader reform efforts. And last Congress, we had lawmakers pull together a pretty robust bipartisan package that would have dealt with a number of the sort of short-term extender stuff that we just talked about, and also would have started chipping away at some of these longer term things. And that was a pretty good example of a big bipartisan package that, we know what happened to that when certain tweets started flying. But if you sort of look ahead, and I want to bring everyone back in here, what do you think it would take sort of politically and practically for Congress to come back together after what's been a really challenging year and is likely to stay challenging, to solidify a more sort of predictable long-term path for these programs and some of the other issues sitting around out there?
Yeah, I mean, oh, sorry.
Please.
Yeah, hey,
I'm
go
not-
ahead.
I'm happy to start off. For better or worse, there are a lot of downsides, to say the least, to the shutdown. But one thing it has done is shine a very bright spotlight on healthcare and the need to take more action in healthcare. And that's true in every congressional office across the board, with all staff who are getting up to speed on these issues just by necessity now. So I think what's key to keep an eye on is the idea that this is not a problem that just faces the federal programs. It's not a problem that just places the marketplaces. This is a problem for everybody in the commercial sector as well, the 160 million people who get their health insurance from the employer-based system. And we just saw that today. KFF released their annual employer health benefits survey, which showed that the first time in 2 decades that the cost of covering a family of 4 has risen by 6% or more for 3 consecutive years. So this is an issue that everyone is focused on, regardless of where you get your health insurance. And it's now a real issue for state budgets as well, because states are going to be forced to backfill for the cuts that were included in HR 1. So they're going to be the real laboratories that can often prove results to inform federal progress. And we're going to need some real evaluation there based on agreed upon data as an aside. But there's a reason for the parties to come together to have a serious conversation about this. And I do think that there is a lot of agreement in principle around a number of things. Chris mentioned a couple of these, but the idea that we need more transparency of prices in the system that payers can use, but that consumers can also, while not being responsible for, can also use in a consumer-friendly form. And what is that form? We have to figure out how to make sure that AI is a positive disruptor that brings down costs, and everyone seems invested in that. Prices are too high and consolidation contributes to the high prices. There isn't enough access to healthcare services and there aren't enough healthcare providers. The mental health crisis facing our kids. I think there's general agreement around those issues. But there is, and others have mentioned this, there is a level of distrust and animosity right now that I haven't seen before. And there is a truly the need to get past that. So I think what you really need here to be able to address those issues and have agreement upon them and move forward is leadership. It's going to require leadership and someone to put a really fine point on the need to move forward here, given just the outcry from the American public that they need relief on their healthcare costs.
Well, Rodney, let's say we still have the leadership in place now, in a few weeks. What are some of these? Are there any sort of policy level ideas, reforms in your head that could sort of serve as that basis for longer term extensions and reforms?
Absolutely. You've got pharmacy benefit manager, PBM reform. We've seen conversations out there about how physicians are paid. We've seen work done on the Medicare Advantage program and how it works and whether or not it could be more efficient. If you want to talk leadership, a way to approach it is the Republicans in the House and Senate could drive towards policy and give their Democratic counterparts the opportunity to decide, do you want to participate? But I think what we're also missing is how much, and Yvette said something that's really important. The spotlight's on healthcare right now, but is that spotlight on the temporary enhanced APTCs, or is it on the healthcare problem? The healthcare system is broken. It is problematic. It is not working. And in this moment, if that continues to roll, where do we go? Are we going to be in this place where a populist approach to fixing the healthcare system comes up, becomes partisan, and then blows out every other conversation we could see happening on other healthcare issues? In certain respects, Pandora's box feels like it's cracked, might be ready to blow wide open on, hey, this is not working. We need to look at something radically different. Somebody's ready to take that mantra.
Mm-hmm. So Chris and Amy, anything you want to say in that realm?
Yeah, I just want to say that, we do need to look at this holistically, and we have to look at the contributors to poor health status as well. The nutrition issues are big. I think, Maha, there's definitely some positives there that Republicans and Democrats can be looking at. We do have a huge nutrition issues. We got an obesity problem. We have chemical and substance abuse issues. We have isolation and mental health issues that are really driving. Every parent that I know of is very, very concerned on these issues. And on the AI, more practically, the administration is thinking about being more aggressive in the application of AI to stop inappropriate billings, so fraud and abuse on that front, or to make things more administratively simple. So again, I don't want us, even though there is this momentary dynamic of extraordinary partisanship around the issue of the Affordable Care Act and subsidies, which, by the way, I don't think those people should be penalized for our inability to address those problems, Rodney. These people are going to see a doubling of their premiums, and I don't think that you or I can come up with an intervention that are going to constrain those costs in the next year. So my view is, yes, if there are some down payments we can do on cost containment, let's absolutely do them. Let's do it even in the context of bipartisan negotiations on finding ways to extend the enhanced premium tax credit in some reformed way and some acceptable vehicle. But let's not just say, let's not do anything. Let's just not turn our backs on people who really need to be able to afford accessible healthcare and access the providers that they need.
One aspect I feel like we have to mention to really understand the position we find ourselves in as a country and on Capitol Hill and in the administration is this question of our growing debt and deficit and how much that is weighing on especially Republican policymakers. It's unsustainable. It's at levels that really can't be maintained going forward and continue to produce, a sound economic picture for the American public. And I think that is playing an ever increasing role in these discussions. And when it comes to healthcare, the fundamental question that has not been resolved, in my view, is the role of the federal government to help those at the lower end of the income scale, which is clearly the more predominant view on the Republican side of the aisle, or is it to subsidize everyone at a higher level and to really address some of these core issues across the board, which is obviously a lot more expensive to undertake. And to me, that is really fundamental to a lot of the issues where we find an impasse currently.
All right, Amy, so you get the last word on that little section. We've got, we're running a little low on time, but we've got a couple of audience questions we wanted to get to. Chris and Rodney, one of those questions is, there are areas like telehealth policy that have historically drawn lots of bipartisan support. And going into next year, do you see other opportunities like that for bipartisan collaboration, where we might actually get past some of the noise and fighting?
Rodney, you get to go first, but
And I will take that so you can undercut me afterwards. So listen, I think they've worked on lots of things together, at committee levels. They're not going to be page A1 type issues. Telehealth, they may get there. They may be able to talk about physician payments. I spoke to some of these earlier. Again, I think the question is, how much can they get around the nuts and bolts of wanting to work on some of these issues, wanting to pay for these issues as we get into an even numbered year? And even numbered years are election years. And we're just going to have to see whether or not they're going to be able to get over how they feel right now and try to accomplish some things. I don't think that's a certainty by any stretch.
and the bipartisan support of community health centers is just a historical one, so I imagine that will continue. For different reasons, both parties actually think that's an important element to be able to maintain. I do see mental health issues. I see transparency issues. I absolutely agree with Rodney. Telehealth. Are they but workforce issues, even medical education issues? More and more people are very concerned about that too. And then the appropriate application of AI. So in many things, I do see some ways to come together. I will say it's hard to legislate when the House continues not to be in session, but that's my side critique of hard to see it. And I will say, as we get closer and closer of not agreeing on something on the government funding and on the Affordable Care Act funding issues, it's going to be hard to see the time left over to do the type of work that's necessary, particularly if you want to do bigger, longer term issues. I think we'll be talking more, Michael, about shorter term extensions of what we've already sort of semi agreed to. And that's only if, we have some kumbaya moment.
Well, thanks. We're starting to get pretty close to on our time here, and there was another audience question that I want to ask, but we also want to give everyone a chance to have sort of a wrap on some of the important things that they would like to emphasize. So I'll sort of put those together, and maybe Amy and Yvette can start. And the audience question is, like, when you sort of take a broader view when it comes to Congress, the big question is, how are we going to pay for this? And I think that means more than just pay for us. I think that means much more broader in terms of the whole sort of country and government. But there are all these immediate short-term items that Congress has to deal with related to the shutdown, to health extenders, and but these big high cost healthcare issues still continue to dominate the conversation. We brought them up a little bit here. So where and how do you think Congress can come together to address some of this overall healthcare spending? And if you want to work that together with your sort of closings, feel free.
Yeah, I mean, how to pay for things has always been, it's always been a difficult, it's always been very political. There's lots of stakeholders with very vested interests. And, there's nothing like passing a $5 trillion tax cut bill to blow a hole in the deficit. But I think it's all a matter of how you prioritize moving forward. I do think Rodney mentioned one thing where I am actually very hopeful that might serve as the vehicle moving forward. And that is this idea that there is continued interest in reforming the way that we pay physicians under the Medicare program. There's interest in that, bipartisan interest, bicameral interest, driven largely by the doc caucuses in each of the House and the Senate. And I think that pulls a lot of very pressing issues into play, whether it be the workforce issues, the mental health issues, the primary care. How are we incentivizing primary care? How are we incentivizing beneficiaries to seek the most effective, cost-effective care? And there seems to me to be a lot of agreement around that. Now, how you pay for something like that, of course, will continue to be part of the conversation. There is some agreement around possible ways to pay for these, and I'm certain that if there's enough interest and the requisite leadership, we can find a way to get there. I think it's going to require, getting past this moment in time, with the ability to get back to the table. And that's one of the things that we all sort of need to try and to protect is let's get out of this situation with some agreement and some ability to get back to the table to continue talking to each other. And if we can do that, I don't doubt that we can find a way to get to some bipartisan agreement, both on the policies moving forward and the pay-fors.
I'll just pile on with a few little notes. The first, I think, really does go back to this fundamental need to reach an agreement about what is the role of government in healthcare generally. Is it to subsidize and help those at the lower income levels, which most Republicans are very comfortable with? Or is it in fact to go above those levels? And that's really the disagreement we've seen play out both in Medicaid due to the expansion that happened previously, and then also the enhanced premium tax credit debate. Republicans really drawing a line and saying, we're not comfortable borrowing money to pay for that because of the nature of our debt and deficit. The other just quick note I'd make is that unfortunately, because we are in this shutdown dynamic, and look, we've done it before as Republicans too. It's easy to figure out how to get into the shutdown. It's very challenging to figure out how to get out of the shutdown. And I very much worry about our ability to reach what was a really growing positive set of negotiations on the appropriations front as well. And with time, running out, how do we get back to a place where people are able to negotiate? Or are we forced to go into a CR, which does not bode well for the health space going forward, if that's where we land?
Let me just say one thing for 30 seconds, and then I'll turn it over to Rodney, is that the one thing I just say about Amy's comment about subsidizing people at the lower income versus the higher income levels is that I think it's really important for us to recognize that we provide tax exclusion policies for 160 million people in the employer-sponsored coverage. And that is a huge part of what we do support. And the idea that we don't provide some sort of tax exclusion or some sort of tax benefits for small businesses, farmers, self-employed people in the marketplace, just like we do for the ESI population, seems to me questionable at best.
I'll be super fast. I think healthcare stakeholders should be really concerned that the ground is being plowed for a Pied Piper to come along promising low-cost, high-quality healthcare for all Americans. That person can win elections, but we all know it's much more complicated than that.
This is where we start singing Kumbaya together.
Yeah. Well, I mean, that was a great discussion, and I want to thank the audience for taking a break from their shutdown showdown so that they could participate and hear what y'all had to say. And we did hear some possibilities of sort of bipartisan common ground, AI, PBMs, transparency. Like there's a whole bunch of stuff underneath the surface that you might actually see some progress on if, as I think it was Yvette said, if the leaders can sort of pull people together. But all those issues are out there, and they are more bipartisan than I think some people would imagine. So again, thanks everybody. This was a great discussion. And hey, you can read about it on Modern Healthcare. We get deep into some of these. And the Bipartisan Policy Center has some really, really deep analysis on some of these issues. So go look at that too.